Hello everyone, this is my fifth video on motor system examination. Today I am going to tell you how to assess the muscle power of hand and fingers muscle. In first 4 video I have already covered how to assess the posture, bulk and the tone and the muscle power of the neck, shoulder, elbow and the wrist movement. For assessment of hand and fingers muscle power, we have to perform the movements at the finger as a flexion, extension, adduction, abduction of the fingers and opposition of little finger. So first is flexion of finger. In this flexion at the metacarpophalangeal joint, proximal and the distal interphalangeal joint should be assessed. For assessment of flexion of finger, we have to keep the forearm supinated, palm up position and the fingers should be extended, and we will tell the child to flex the finger at metacarpophalanges, proximal interphalanges and the distal interphalanges joint. And for against resistance, we will keep our finger over the joint. So the muscle for the flexion at the distal interphalanges joint by the FDP muscle, flexor digitorum profundus, and there are two heads of FDP, radial head and ulnar head. Now supply to the radial head is by anterior interosseous branch of the median nerve and ulnar head of the FDP by the ulnar nerve. Now the flexion at the proximal interphalangeal joint of the finger by the FDS muscle, flexor digitorum superficialis. It also flexes the MCP joint, metacarpophalangeal joint. Ultimately it helps in flexion at the wrist also. It is supplied by the main trunk of the median nerve C8 to T1. Now the flexion at the metacarpophalangeal joint by the interossei and lumbricans, which is supplied by the C8 to T1 deep palmar branch of ulnar nerve. Also we have to tell the child to make the fist. Whenever child will make a fist, there will be flexion of finger at the metacarpophalangeal and interphalangeal joint. Also thumb flexion to brace the finger, and slight wrist extensor also work whenever child will make the fist. Now the extension of finger. For this we will keep the forearm of the child pronated and hand should be outstretched, and we will keep our hand over the finger to push it downward, and we will tell the child to resist the finger flexion at the metacarpophalangeal joint. So the muscle for the extension of finger are EDC, EIP and EDM. EDC, extensor digitorum communis, it extends the MCP joint. EIP, extensor indicis proprius, it extends the index finger. And EDM, extensor digiti minimi, it extends the little finger. And all these three nerves are supplied by the posterior interosseous branch of radial nerve C7 to C8, and interossei and lumbricans extend the interphalangeal joint, both proximal and distal interphalangeal joint. Now for the adduction of finger, we will tell the child to bring the finger tightly together, or we will give the paper to the child to hold it between two fingers, and the muscle for the adduction are volar or palmar interossei. Now for the abduction of finger, first we will tell the child to spread the finger apart, and for the against resistance we will give the adduction force and child will try to abduct the fingers. And the muscle for the abduction are dorsal interossei except for the little finger, for which the muscle is abductor digiti minimi. Now for the opposition of little finger, we will tell the patient to move the extended little finger toward the thumb, and the muscle for the opposition of little finger is opponens digiti minimi, supplied by the ulnar nerve C8 to T1. So this is the way to assess the muscle power of hand and fingers. In next video, I will explain how to assess the muscle power of thumb muscle. Thank you so much.